This is a really hard time for medics in the UK, especially those who are unemployed and trying to find work and really struggling. Many of us have seen the BMA survey of FY2s who finished last month saying that 52% of people didn't actually have work. And this isn't just the case for FI2s, it's actually the case across the board for qualified GPs, people who've finished specialty training, and people in between at all stages. Whilst it's really difficult for me to give advice for people in this situation, all I could say is keep trying, keep your hopes up, and apply to as many places as possible, even places outside of the NHS and things that might not be directly relevant. Whilst you're applying to these jobs, it's really important that all medics, take a step back and actually just assess the situation of healthcare in the UK. Everyone, and I mean everyone, really needs to be considering their future in the NHS and within healthcare. And what that means practically is trying to upskill yourself during medical school and beyond, in not just medicine and everything that's related to healthcare, but also things outside. Now, there's a couple of reasons this is important. It tries to safeguard your future if something like this happens to you, and we hope it doesn't, but it's unfortunately the reality in today's world. And the best type of things to explore are things which are on the up and are essentially going to trend within society in the next few years. Now, what this looks like today is around tech and specifically AI. There's actually some opportunities for doctors and healthcare workers specifically to upskill themselves in these fields, given by the government and even from universities to do, for example, masters to help you transition into digital health. What that means practically is that you are much more attractive to health tech companies who are looking for doctors with that skill set in tech and AI and some sort of understanding of the medical landscape. Saying that, my suspicion is that these opportunities are going to dry up in the next few years, just with people realizing this first of all, and secondly, government funding just drying up. So do look out for them and try to capitalize on them while they're still available.